Section 5 Patient Care and Documentation of Services. This section applies to all licensed practitioners. Section 5.1 Faculty Implementation. All therapy services need to be documented and medically necessary. Therapy services performed by assistants need to be performed according to the therapist's plan of care. For federal payers, such as Medicare Part B and TRICARE, therapy services must be performed under direct supervision with a therapist on site. Medicare Part A services are allowed to be performed under indirect supervision with the therapist making a supervisory visit at least every 30 days. Services that do not require the performance or supervision of a therapist are not skilled and are not considered reasonable or necessary services. There must be the expectation that the patient's condition will improve in a reasonable period of time. Amount, frequency and duration of the services must be reasonable under accepted standards of practice. Section 5.2 Physician Referrals. Scripts and primary care physician referrals are different. A script for a treatment provides evidence that the patient displays a need for care and is under the treatment of a physician and doesn't have to be from a specific doctor. A primary care physician referral must be from the patient's primary care doctor. HMOs and managed care plans often require a referral from the patient's primary care physician. For Medicare patients, a script or referral is evidence the patient is under the care of a physician, and we need to send that physician the patient's plan of care for certification. It's generally a good idea to fax the plan of cares from evaluations and progress notes to all referring physicians, so they are aware of their patient's treatment and progress before any follow-up visits. Section 5.3 Evaluations. Evaluations are required prior to beginning therapy. Patients must exhibit a change from normal functional ability to warrant an evaluation. If you perform an evaluation and determine that therapy is not required, you must document this determination. Section 5.4 Plan of Care. A plan of care has to be on file before patient treatment may begin. Treatment may begin prior to committing the plan of care to writing if therapy is performed or supervised by the therapist, who performs the initial evaluation and establishes the plan of care. The plan of care must contain diagnosis, long-term goals, modalities and procedures, frequency and duration of treatment, and the signature of the person establishing the plan of care. It's good business practice to fax completed plans of care and progress notes to referring physicians for all patients, so they have a record of the patient's progress for follow-up visits. It's mandatory that we fax the completed plan of care and progress notes to the referring physician for all Medicare patients. For Medicare patients, the plan of care needs to be certified by the patient's physician. The plan is certified once it has been signed and dated by the patient's physician. Initial certification of the plan of care is valid for 90 days or the length of the plan of care. Plans must be recertified every 90 days. Plans must also be recertified to approve any significant changes such as a change in long-term goals. All attempts to have Medicare plans of care need to be documented to account for delayed certification. Section 5.5 Documentation Requirements. This section goes over all the documentation requirements that therapists need to be in compliance with. Evaluations need to document medical necessity and include the diagnosis, subjective impressions of the patient's current functional status, objective measurable data, assessment scores and the plan of care. All patients are required to complete an outcome measurement tool with their initial eval, re-eval, progress note and discharge if known. If the initial evaluation determines that therapy is not needed, then the determination needs to be documented. Progress notes and re-evaluations need to be completed in a timely manner. In Virginia, patients need to be re-evaluated every 12 visits or 30 days, whichever comes first. Patients treating for 6 months or longer, re-evaluations should be every 90 days. In Maryland, patients need to have a progress note every 10 visits or 30 days, whichever comes first. Patients should be re-evaluated every 30 days unless the therapist documents in the patient's record an appropriate rationale for not re-evaluating the patient consistent with accepted standards of care. Documentation is required for every treatment day and procedure code in the form of a daily note. Daily notes should be completed in the office, not at home, within 24 hours of the visit. Discharge notes must be timely and also provide a reason for the discharge. When completing notes for federal payers, therapy is billed on total time under the 8-minute rule. The chart shows how many units may be billed based on the total time. A 30-minute visit can bill for 2 timed units. For all non-federal payers we can bill under the rule of 8 seconds, and it is based on the time per procedure and not total time. If 8 minutes of a timed code is performed, then 1 unit can be billed to non-federal payers. For a non-federal payer, if a patient completes 3 timed codes for 10 minutes each, then a total of 3 units can be billed, whereas only 2 are allowed for federal payers. For Medicare patients there is a therapy cap placing a financial limit on therapy services. For 2021 the cap limit is $2,110. A patient may qualify for an exception to the cap limit when their condition is justified by documentation indicating the patient requires continued therapy beyond the cap limit to achieve prior functional status or maximum expected functional status within a reasonable amount of time. Documentation must support that services are medically necessary. If patients qualify for an exception to the therapy cap supported by documentation, then the KX modifier is added to their services. By adding this modifier, the provider is attesting the services billed qualify for an exception, and our services are reasonable and necessary based on their condition and response to treatment.